Facebook Live real quick in the Lifestyle Medicine Interest Group for Physicians. And can someone respond to Neil while I figure this out here? Lifestyle Medicine, Brainstorming. Webinar is here. All right. Okay. So, all right. Okay, perfect. Whew, okay, only 7 minutes in. That's not too bad. Okay, so hello everyone. There are 30 of us on this call right now. It's super exciting. Had over 110 people sign up, so definitely people are interested in lifestyle medicine. This is gonna be on a replay. And you guys, so if you have to step off or something like that, you can always come back to it. So again, I'm Heather Hammerstedt. I'm an emergency physician and I'm a board certified lifestyle medicine physician. You all asked me from the Lifestyle Medicine Interest Group for Women Physicians to put together this brainstorming webinar so that we could all talk about what's out there in lifestyle medicine, what's working for some and not for others, and whether it's for you if you aren't yet practicing. There are a few housekeeping issues. I want you to interact, and I don't want this just to be me talking. So hop on the chat button there. Let me know what you're thinking, what questions you have, and I'll try to answer them, or other people can answer them. Also, if you want to come on and share, you have to be on your computer and not on your phone, preferably on that Chrome browser. And you can just chat box it to me and I'll invite you on as a presenter. You'll get a little pop-up that you have to accept, and then you'll be able to come on. And next, if someone could moderate some comments for me on the Lifestyle Medicine Interest Group for Women Physicians. I'm streaming this there, and I can't do both at the same time because I have like the webinar up and my presentation thing up. Yes, Jessica, I'm going to try to be done 1 hour after starting. Depends on how many people want to share. So if someone could moderate those comments for me in that Facebook group, maybe look over there and see if there's comments and put them in the chat here and I can respond to them. If you can do that, someone give me a thumbs up in the chat box. That would be awesome. Okay, let's get started. So what is lifestyle medicine? Lifestyle medicine is an evidence-based practice that helps individuals and families improve their health and quality of life by adopting and sustaining lifestyle behaviors. And most of us knew this intuitively, that lifestyle choices are the root cause of many of our chronic diseases. And the scientific evidence is pretty clear that you can prevent and reverse 80% of diseases with healthy lifestyle choices. You heard me right. Healthy lifestyle is the medicine that can prevent as much as 80% of chronic disease, and no other medicine can do this. So lifestyle medicine involves the use of evidence-based lifestyle therapeutic approaches, like a predominantly whole food diet, mostly plant-based, regular physical activity, adequate sleep, stress management, avoidance of risky substance abuse, and other non-drug modalities. Unfortunately, most physicians don't know all of this data, and the science of health coaching for behavioral change, we don't know about that either. And we don't usually have the time to sit and like figure out how to help people implement these important changes. So our health individually and as society is plummeting, not to mention the healthcare spending that comes with that, and it's all avoidable, right? So 70% of PCP visits are related to stress. I bet you guys know that. 80% of disease is preventable. So we were never taught any of this in medical school. So do you want to remember why you went to medical school? Do you want to feel like you can answer the questions your patients have for you? Do you want to feel engaged and excited about medicine? I know a lot of us are feeling kind of hurt by medicine and all the layers between us and the patients, and we don't feel like we're really making the impact that we thought that we'd have. So learning about lifestyle medicine might be for you. And again, that's evidence behind using food, exercise, sleep, mindfulness, modification of tobacco, alcohol risk behaviors. So how do you do it basically? So let me go to the other slide here. You can do it through the American College of Lifestyle Medicine. And Jolly, I'm speaking your mind. I love that. And that's the American Board of Lifestyle Medicine. And then there you can obviously integrate this information into whatever practice that you have without certifying. So let's talk a little bit first about the American College of Lifestyle Medicine. So they offer a certification process for physicians to sit for a board exam. And the board exam is from a separate organization, the American Board of Lifestyle Medicine. So similar to like me in emergency medicine, we have our American College of Emergency Physicians, and then we have the American Board of Emergency Medicine that does the kind of overseeing. So certainly certifying legitimizes and formalizes the idea and practice of lifestyle medicine, really making it its own specialty. How did I do that? Making it its own specialty. The plan is that they're going to go through the National Board of Medical Examiners to get formal approval of lifestyle medicine as its own specialty, and then grandfather everyone who passed in. So sort of like palliative care, EMS, they did that too, and then have fellowships. I think there's like one fellowship now in South Dakota already, but basically at this point, 2017 and 2018 were the first years that they were offering this exam. So how to certify? So let me see here. There is, let me pull up something that I can read for you guys about this. So to certify as a lifestyle medicine physician, you must be board certified by a medical specialty board recognized by the ABMS. And you must be credentialed as a physician in your country of residence for people outside the United States. There's also an international board of lifestyle medicine as well. They also have paths to lifestyle medicine for doctors who are not medical doctors, and for practitioners like nurses and or registered dietitians. So it's pretty interesting. The board exam is, let's see, the prerequisites. Somebody was asking about that. So you have to have 30 hours of, I think I put it in here. Is it in here? No. Nope. So you have to have basically 30 hours of online CME, and there's a bunch of different ways you can do that. If you go on the ablm.co how to certify, and I will pop that in the chat box here. There we go. If you go there, you'll be able to see all of the places that you can do your online content, and basically 30 hours for CME, and then in-person learning, you have to go to one conference for at least 10 hours. The conferences that I went to in the last couple of years have been really awesome, and you have to do all that within about 36 months from the time of registration. So, and then you take an exam, and the exam is like, I can't remember, 150 questions. You had 4 hours to take it. You had to, we had to take it all in the same room. So it was required some transfer. I would say all in all, it was probably $3,000 process, because the board exam is $2,000. And then the travel to the conferences, paying for the conferences, paying for board review stuff. I think that the online content that the American Preventative Medicine, the kind of core content stuff for the online stuff was like pretty darn boring, which is why, one of the reasons why I wrote my own course, but I'll talk to you about that a little bit more later. But so anyway, that's kind of the path to kind of legitimizing the actual board certification. And I think, again, it's not necessary for everyone to do that. But I think that it's helpful, especially if you are maybe not primary care based. Like for me, I was in emergency medicine. I knew a lot of this stuff because I'm an integrative nutrition health coach. But it's easier to be able to say, like, this is my button of like why my badge on why, I would know this stuff in emergency medicine. So those of you who are maybe, I know Neil's in psychiatry, and there's some surgeons on here, and anesthesia, these are all things, dermatology. Yeah, these are all things that we can incorporate into your practice and really make a difference with people when they have the opportunity to do it. So, okay, so non-certified, again, this is sort of what I was just talking about. We all need this information, right? I mean, how much more satisfied do you feel when you can actually provide advice that people need at the time that they need it. And so I don't think we all need to be ACLM certified. I think if you want to do it, now's probably the time to do it. Oh yeah, we have OB and PEDS on here because you can be grandfathered in before it's a fellowship. But I don't, you can learn the information in a myriad of ways. I use this information in my emergency medicine work like every single day in like 30-second to 2-minute exchanges with my patients on food and weight and exercise and mindfulness. And it's really brought me a lot of professional satisfaction. And I think we all need this information for our satisfaction, for our patient outcomes, for us to kind of rescue our healthcare system from our burnout and from chronic disease and our patients, right? And for our own personal health futures, right? If your cup isn't full, you can't really fill others. All right, we have internal medicine, obesity med, family medicine. I love this, guys. We are all better together. Can you imagine like if we were all practicing this way and how much better everything would be? Judy's internal medicine, perfect. So we have a couple people joining us still. As a reminder, this is Dr. Heather Hammerstedt, emergency medicine, lifestyle medicine. We were just talking about how to certify or whether you need to certify in lifestyle medicine. And if someone could put a chat in there for people joining who may not have audio on how you guys figured out how to get that so that they can see that. Okay, so I have like 5 or 6 people who are going to come in and talk about different practice settings that they are in. And so while I'm waiting for some of them to, we have another certification, Cheryl, true, awesome. I'm just going to talk a little bit about Wholist and what I do. So let me talk about that. A ton of you asked me to explain what I am doing with Wholist and how I got here. We'll go through what other types of practice settings are. And for now, I'll just kind of finish this because people were asking about it. So the Weight Wellness Program is a high value personal coaching program. It's 12 weeks of one-on-one work on food, mindset around food, and weight loss. People who have killed it in this program have fall into basically 3 hats. One, people who want to lose weight. Basically, most people who are committed are 10% body weight down in 12 weeks. The second is food relationships and education around food, those people that want just that information. And then athletes who want to up their game. And that's been one of the more exciting things. I've had a couple of athletes come in who just by changing their food have really changed their outcomes. So daily podcast delivery to your phone of 10 to 20-minute podcasts on weight science and mindset work. You get accompanied documents and worksheets and a weekly personal call with a coach, which is a dietitian, doctor, or a nurse. For questions, you have support, coaching, and accountability with that. So it's pretty unique and it's very exciting. And I created it all myself, and it was not easy, like 1,000 hours worth of work. But bonuses are that a high value program means you don't need to get a ton of clients. The difficult part is figuring out how to market it and find the right people. And I will drop a link here to the to that. Let's see here. If you guys are interested and want to take a look at it. And let's see, I have, thank you for the comment on my infographic. I was quite proud of it. I also have other things that we do. We have culinary strategy sessions with a chef, how to modify and amplify your cooking plan. We have a virtual fitness training program where a personal coach sets up your plan with you and you have bi-weekly coaching calls. We have organic meal planning strategy and some botanical skincare. And then, let's see, lifestyle medicine. I've just started doing some lifestyle medicine telehealth consults for the states that I'm licensed in. So I've created fillable assessments and action plans on all of the main parts of lifestyle medicine: food, exercise, sleep, mindfulness, tobacco, alcohol, that are super easy to use and repurpose back to the patient. So I do a 75-minute call and then a 30-minute follow-up call. And again, I'm just getting started with that. So I can't say what works and what doesn't yet, but it is pretty exciting. And perfect. So Anjali is doing telemedicine too. If you want to come on and let us know how that's working for you, certainly give me a thumbs up when we get to the telehealth section in the practice settings. Okay, so last thing is this telemedicine course. I'm super stoked about lifestyle medicine and the opportunity to take back our professional satisfaction and our patient lives and outcomes. And there's so much bullshit out there, so many like layers between you and your patient. And I think we can fix this as doctors by having real conversations with each other, by collaborating together, by taking leadership roles, by advocating, and by using evidence and empowerment and education to be able to talk to our patients, right? We all deserve this information for our professions, our personal lives, and our patients. So I busted my ass and I wrote an 8-week course for physicians who want the information but don't need to certify. It also would be great for someone who is going to be doing a certification but wants a different way to learn than is currently offered. It's set up like my weight program for like uber flexibility and convenience. Daily podcast delivery of your knowledge for the day right to your phone, accompanying transcripts and documents. You can see right here on the page, that's the podcast. This is what it looks like online. We have access to it as a web portal, but this is the podcast. There's a transcript there. There's references, and there is a document. This is an example of one of the visuals from that. You also get a daily 2-minute, what I call the hammer takeaway for easy repeating to your patients that you can use. And each subject comes with patient assessments and fillable action prescription plan that you can use immediately with your patients. And there is a Slack group for accountability and running questions off of each other during the course. And so I'm really excited to premiere this all to you. It's been a labor of love, really just to be able to get you off the ground running. It does start February 4th. And let's see, I have a link to it here. I'm going to take this weight program off there, and here is the online course, and that will link you to it. Of course, you can always find this at www.holisthealth.com, or you can email me at hello@holisthealth.com. All right. So that is what I have been up to. Their last question, will your course go to the 30 CME hours? I just wrote this course in the last month after I mentioned it on the Facebook group, and had 60 people say that they wanted me to do it. So I basically haven't done anything else besides create this. And I have not gotten in touch with ACLM. My guess is that it probably wouldn't be at this time, but I can do it. I'm reading the chats. But I am planning on contacting them about it. But the answer is for now, no. Let's see, Felicia, do you at least need to be a certified coach for this course to be effective for your patients? So I'm going to talk a little bit about coaching in a minute when we talk about practice settings, Felicia. I don't think you need to be a certified coach necessarily, but certainly not for this course. There's a whole week of my course that talks about health behavior change and how to coach. So it's a ton of information. You don't need to be certified. So another question, how did you start telemedicine, lifestyle medicine practice? I just started throwing myself out there on social media and advertising, and then I've been going around and talking to the docs in town. Wondering for telemedicine. Yeah, okay, so we're starting to get into some other things. Anybody else have any other questions about the course or the weight program? And otherwise we will move on. Okay, so again, 8-week course. And the best thing about it, I think, is really that you have the documents that you literally, your patient can fill out, hand it to you. You have another document that tells you how to interpret it, and another document that's an action plan that you fill out with them and send them home with. So I've done the work for you. It's worth it just for that. So, okay, let me go back to this browser and let me see here. I want to go back again. And practice settings. Okay, so yes, Regina, please share the course details. I would love for anybody who wants this information to join us for the February 4th start date. If you would like, I can make a post on the Lifestyle Medicine Interest Group, one that you can share maybe, or copy and share. Okay, so now we are off running. Practice settings. Let's hear what everyone else is doing. Direct primary care. So Lori, are you here? If you are here, give me a, so that Manisha, if you click, hi Lori, great, I'm gonna take you on here in a second. Manisha can't see the chat. There's like, I think you can toggle back and forth between the offers and the chat, or the link is covering the chat. Okay, I'll take it off and put it on at the end. Remove offer. Thank you. I'm learning as I go here. Okay. All right. Let me find Lori. Oh my gosh, there's so many of you on here. It's so exciting. Okay, Lori, and I'm going to make you a presenter. You'll see something pop up on your side, and then you'll have to turn on your, you have to accept it and then hit the start presenting, and then turn your video on. So Lori is here, Dr. Carnsu from Verity Medicine in South Carolina, veritymedicine.com. She's going to come on and to explain to us what direct primary care is, and then about how you've incorporated lifestyle medicine in. So direct primary care, I don't think it necessarily has to be all primary care. It's kind of like the direct care is the no insurance model, right? Where people pay a subscription fee or cash for care. And hi, how are you?
Oh, there I'm good.
Thanks for joining. So tell us a little bit about direct primary care and how you're incorporating lifestyle medicine.
Okay, well, I am a family doctor, and I started in about 2000. So as all of you, the same frustrations with the current system, and kind of got into lifestyle medicine. So 2 years ago, I started a direct primary care practice. And it kind of just, I broke it with insurance, with Medicare. I said, I'm not playing a game that I cannot win, and the rules keep changing. Yeah. So I finally went into, made the jump, started my office, and designed it from the ground up. So I have a teaching kitchen and a space where people can sit for group visits. And it's a cash basis, because the challenge for me was, how do I get paid for doing lifestyle medicine? And this is a way that I wanted to make it affordable to patients, and so that everybody, even, you know, lower class and middle class, could come in and enjoy it. And so right now, my membership is like $65 a month for adults, and that's kind of about the average throughout the country. Yeah. They pay a monthly membership fee. I do full family medicine. So because I don't have to negotiate with insurance, and I don't have to jump through the hoops, I have one doctor and one medical assistant, and we do it all. I'll probably have a second person on by the time I'm full. But it allows me to keep a full schedule of only 600 to 800 patients instead of the 4,200 I had at my last practice.
Wow, amazing. So Felicia's wondering what your max patient panel. Oh yeah, you just got there. Perfect. So tell us a little bit about the teaching kitchen.
So I designed that, and we actually just started a class today. So I have something that I just started playing with at my old office in the lobby. I invited some of my patients who were interested in making lifestyle changes, and I kind of, you know, it's almost like a mini version of a Dean Ornish program. So 80% of it is we talk about nutrition. I have one class I talk about activity, and one that's really focused on mindfulness.
Yeah.
And it's a series of 8. And so I made that included in my membership. And then I realized, well, people aren't going to, you know, something's free. They got to put a little money in the game. So it's a $10 thing. Yeah, and it really seems to kind of be the magic thing that they'll commit to at least 6 classes.
Yeah.
So yeah. And so I'm
just going to respond to someone here. Maria, this is Dr. Lori. How do I say your last name? Kernshaw?
Carnsu.
Carnsu. She is in South Carolina. That's the question. So
yes, I'm in upstate South Carolina. So I moved here from where I was from. This was called the Bible Belt. got here, realized it's the diabetes belt, it's the stroke belt, it's the biscuit belt.
Yeah.
So it is a
Causing
very tough culture here to crack as far as getting people to give up macaroni, cheese, fried chicken, and green beans with bacon, which is the Sunday dinner standard.
Yeah. Dr. Krant wants to know if you teach the cooking yourself.
Yes. So I have, we've worked the last couple of years collaborating with a cooking coach or someone else. But right now, my medical assistant kind of prepares the food. I have a little mini lecture. I still consider myself a science geek, and I really kind of put a lot of science in there to kind of emphasize how much evidence there is for the changes that people make.
Yeah.
So we talk, each class, we do one recipe, they get to taste it. We talk about the science, and at the end we talk about, you know, some other lifestyle thing. There might be a protein focus one day and a carbohydrate focus another day, because these are the hot issues that everybody's asking me about.
Totally. So we have another question that says, is this different than culinary medicine? What I would say is, there is a course that you can take through the Institute of Lifestyle Medicine that is a chef coaching course. So basically culinary coaching, culinary medicine, where they teach you about how to coach around the idea of food. That is kind of the certification area for the culinary medicine portion, but there are plenty of lifestyle medicine folks, or plenty of people who are not certified in lifestyle medicine who are doing, you know, doing cooking, teaching cooking classes and stuff like that, teaching kitchens. So,
right.
Yeah.
And
I had invited
the challenge,
the guy on, but he didn't get back to me. So,
the big challenge is adding the community in, and that's where we're headed in the future.
Absolutely. Yeah. Anything else about direct primary care that you want to talk to us about before we have someone else join us?
As far as doing lifestyle medicine, I have that luxury now because my new patient visits and my well visits are 1 hour. So one of the biggest helps that I have had is having a little lifestyle intake sheet. So at their well visit every year, my medical system hands them a little checklist, and it's just something I put together. How many fruits and vegetables did you eat yesterday? How many hours do you sleep? And it kind of hits all the buttons. So I can quickly look at that sheet and see, okay, here's where the problems are. This is where we can start as far as coaching goes.
Exactly. So that's definitely like the main portion of my course, you know, is basically giving people fillable access to that they could use on an iPad or have people fill it out or something like that, really just to make it a lot easier. So a couple questions to you before you go. Hats off to you. That's good. Someone wants to know if you're board certified lifestyle medicine. Someone else wants to know
yes.
Yes, you are. Okay. And then how do you get labs done with your patients?
Oh, well, the greatest thing about direct primary care is we can get cash pricing. So I have a contract with a local lab, and they give me cash prices. So they bill me and I bill my patients, or just included. A TSH is $2. A lipid panel is $5. And this isn't just around here. Other doctors around the country have similar prices.
Yeah, we have a handful of direct care here in Boise, Idaho. A good friend of mine is running one. She's been quite successful. She does family medicine and aesthetics out of hers, and it's pretty exciting stuff. I mean, that's what I'm talking about, using lifestyle medicine to kind of improve our own professional satisfaction. And and that's what, you know, the direct primary care or the direct care model, not necessarily having to be primary care, is like just taking back, you know, taking back our system for ourselves and for our patients, you know, so it's great. Awesome. Thank you so much. I'm going to take you off, and we're going to talk about telehealth next. I saw a couple people say that they were in telemedicine. If you guys want to come on and talk, certainly give me a yes. You have to be on your computer. Okay, so I had Sayed Nagori from Simple Health on the line, but she had to run. She has a telehealth online course for docs coming out, and I'll make sure when I get that information, I'll email that out to you guys if you guys are interested. But big tips are, you have to have a license in the state where the patient is. This is a big holdup for many of us, right? I only have a license in 3 states. I'm in California, Oregon, and Idaho. And so I can only take care of patients where they are. It would make more sense if we could take care of people where we were, right? But that's not the way that it works. They're working on that. basically working on that nationally, but it's not going to happen fast because, you know, the state license boards are, it's a business. So, and someone asked about platforms. I'll get there, Felicia. So you can get reimbursed with insurance for telehealth, but it's very dependent on where you are. I would suggest that you go to the American telemedicine. And let me put that in the thing here. There we go. If you go there, there's tons of information there. But basically, if a patient is in Medicare designated shortage area or a county outside of a designated metropolitan area, then Medicare will reimburse you. There are, you know, specific codes that you can, CPT codes that you can use for individual and group health behavior assessments, for medical and individual group medical nutrition therapy, a face-to-face intensive behavioral therapy for cardiovascular disease. You can do an annual wellness visit that way. There's a document that I will try to get up here in a minute. This is here. This is another link to CMS for this. Let me see here. There's a whole bunch of chats. What about malpractice? Understanding is okay. Attorneys, I've asked this question, says the MD, you cannot separate yourself and say you're just a health coach. We're going to talk about coaching later. What about malpractice? I have a policy that covers me and my company. And let's see. And that's about it. Okay, we're going to talk about all the coaching stuff in another one. Okay, so every private payer is going to be a little bit different. Still working on the national level to get that evened out. The ACLM sent me some coding documents that I will share at the end, which could be helpful. They also have member resources and webinars if you're a member of the ACLM with tons of information. Or you could go direct pay and not deal at all with insurance. And this is what I'm doing. The upside is that you don't have to deal. The downside is that people want to use their insurance, right? And they, while they will pay, you know, a ton of money to see, you know, someone random with no medical experience, they want to use insurance to pay doctors. So that is a little bit hard. There are a million telehealth companies out there that are run by business people who will pay you a small amount to do their service for you, or you can branch out on your own. I have a platform for Wholist that I've been considering opening up for others to use with me. And if you want to talk about that, certainly send me an email. Again, it's heather@holisthealth.com, or you can just find me through the website, my website as well. So my company is branded through VC, but there's also the opportunity, like Rodocs is another one. That's a physician-owned organization that that does that. So let's see. Can I add people from different states to work with you, Willie, in the future? That's what I was just saying. I'm contemplating it. I have to I'm new to telehealth, so I've been working on all kind of program development and coaching in this course and stuff like this for the last year and a half. But I have been thinking about that. If we could get a collection of us, right, that work in all different states, we could definitely increase our breadth for sure. So yeah, if anybody's interested in that, send me a note. Okay, so traditional office-based primary care. Do we have Jayshree or Deepa on here? Jay, there you are. Perfect. Okay, so let me find you here on this list. There was a way to, there we go. Okay, so here we go. We'll bring her on here. There are many on here that are practicing primary care and want to just integrate lifestyle medicine into their practice currently. And for those of you who do practice this way, please send a chat if you want to talk about it. Right now, we're waiting for Jayshree. There, you can turn on your. There you go. Hi. How are you?
I'm good. How are you?
Good. Welcome. So, introduce yourself for us.
Hey, I'm Jayshree Chaswawala, family practice and integrative holistic medicine in Texas, Dallas.
Awesome. So, talk to us a little bit about how you've used lifestyle medicine and integrated it into your practice.
So, after I got done with residency, I opened up my own practice. I did one of those 5-year programs with a nearby hospital. But the reason why I chose to open my own practice is because I knew I wanted to practice lifestyle medicine. And my idea was, help patients eat healthier, exercise, just build on that lifestyle as medicine. And
Hey,
so
Jayshree, I'm going to interrupt you real quick. There are a couple people are asking you to turn your mic up, like your volume up
let's see.
on your computer, probably.
I think it's all the way up.
Yeah.
I might have to speak up.
Yeah. Okay. That's fine.
Okay. Is this better? If I'm
Yeah. I'm hearing that most people can hear you fine. So
okay.
Good.
All right. So when I started my practice, that was my idea. I did take insurance. And one of the things I quickly found out is that a lot of people were not interested in that. They just wanted to give me medicine and treat me and let me go, right? I had a lot of patients complain about all this doctor wants is for me to become vegetarian, which was never my message. It was to eat more vegetables, exercise, get some sun, stress. And so I ended up, after a few years, I had kind of weeded that out. The movie Forks Over Knives came out. I loved it. I bought the DVD. I had it playing in my waiting room. And that really helped a lot because now when they came into the room, they already had some idea. And I would say something, and they're like, oh, that doctor on TV said the same thing. Apparently, you have more clout.
Yeah.
And so I did build a great practice where a lot of my patients bought into lifestyle as medicine. We're making a lot of changes, but I came across a challenge of getting insurance to cover it. So I would, bill the time as well as the E&M codes. And a lot of times I would just get audited and I would have to submit the documents, which all my paperwork supported it. It was just such a pain to have to do that every single time.
Yeah.
And you can't see as many patients throughout. So I ended up having to close my practice just because I couldn't sustain a volume that could keep me in practice at doing what I was doing.
Yeah.
So the last couple of years I've been working for a managed care facility, and I've been using that as a platform. We get extended because it's mostly geriatrics, it's mostly Medicare patients. So we get extended time with each patient. However, it still was not enough because we have a lot of requirements like quality metrics, and I have to talk to them about medication adherence, and there's like a lot of checklists. By the time I get through that and all the complaints that they have, and a lot of these patients are multifactorial, like diabetes, congestive heart failure, kidney disease, you kind of have to get them to understand what's going on there, and then get them to understand that just changing a few things in their lifestyle can help tremendously, and then getting them to actually do those things. It has become kind of a challenge. And so I'm at a point right now where I'm transitioning. I'd already put in my notice with this job. My last day is Thursday, from a week from tomorrow.
Congrats.
And yes, I'm excited. I don't quite know. I'm on this webinar so I can learn a lot more about what I can offer.
Yeah.
Because my whole passion and goal is to educate. I do a lot of health talks. And I get a lot of clientele from that and interest. And so I'm just kind of networking and trying to figure out what's the best program to offer.
Yeah, perfect. Great. Good. All right. Well, thank you so much for sharing. And if anyone has questions for her, drop them in the chat and she can respond to you. Thank you.
Thank you.
All right. So yeah, I mean, I think a lot of the problem is time, right? And so that's one of the reasons why I kind of did this, like these 2-minute takeaways, because I'm in emergency medicine, right? Like if I see someone for like 5 minutes, that's like a long time. So I want them to be quick and succinct and to be able to, fill out the action plan at the end of the visit. You could have the nurses and the front staff, hand them out at the beginning. And if you want to do more than that, like awesome sauce, right? Like build a teaching kitchen like Lori, or group visits, which we'll talk about, or build in a gym, but if not, then you can use these assessments to give advice and find your community resources to refer to, right? The plant-based dietitian or mindfulness, cognitive behavioral therapy, and use them, right? So we have about 15 minutes left. I want to be cognizant of your time because I know it's nighttime and we all have a lot going on. I'll talk about coaching, and then Annie Purcell and Francis Zappala are going to pop on to talk a little bit about being hospital-based practitioners and subspecialists. We're going to talk a little bit about shared group visits and some billing and coding stuff. So, man, that's not going to be 15 minutes. All right, I'll do my best. Okay. So, coaching. Coaching is a little tricky. You have to have very solid contracts in that state that you are not practicing medicine, and you should get malpractice anyway, in my opinion. It might be best if you have a coaching certificate and maybe not a lifestyle medicine certification, so you can clearly state that you're coaching, you're wearing your coaching hat. The lawyers, of course, are going to tell you that you can be sued. Of course you can, right? Is someone going to be more likely to sue me because I'm a doctor than another health coach that just like took an online course and doesn't know what they're talking about? Probably. That's unfortunate, but it is what it is. You just have to kind of figure out what your risk tolerance is and what you want to do. So, all right, so the Well Coaches School is a great coach certification program. The Institute for Integrative Nutrition would be a good option as well. Again, I would still recommend getting malpractice. If you're risk averse like me, you can get a policy for like $3,000 a year or so if it's not covered under your regular malpractice, which for me, my malpractice only covers me in emergency medicine, so I had to get my own. So marketing is key here. If you want to be a coach, you need to work on social media presence for sure, and it is a crowded field. So you have to figure out a way to brand yourself and differentiate yourself from the randoms that are health coaching. This means the investment of time and money for sure. And you can also utilize coaching by hiring a coach for your current practice to do the work while you run the medical side. So that's it. So let's see. My malpractice, I don't remember who they're from. I'll try to look at it at the end and put it in the chat. Looks like Cheryl True did Well Coaches, and she has an additional liability policy in addition to malpractice. Yeah, the Well Coaches School, I haven't gone there, but I've been sending the coaches that work for me to it because it's actually approved by the American College of Lifestyle Medicine. They're very, very similar, and they use the same kind of health behavior change, readiness for change, and all those coaching tools. Because to be honest, really, right, like the reason why you need to have a coach hat on for most of this lifestyle change stuff, like we were just talking about being difficult getting people to change, is really because we're used to just prescribing things instead of getting at the base of figuring out where someone is in their decision making about when they're ready for a change and when they're not. It's motivational interviewing, it's cognitive behavioral therapy, and we need to learn all of that really to be able, in my opinion, to be able to really practice lifestyle medicine effectively or coach lifestyle change effectively. And let me see, what else? Anybody have other questions about coaching? Coaching. Yashoda, we did talk about telemedicine already. Let's see. And there's a replay available too if you want. So, okay, coaching. What else about coaching? Anything else? Okay. My telemedicine platform has a monitoring facility. I don't know what that means, Regina. Okay, I am going to pull on, I saw Annie. Let's do you first. You'll see something pop up to join here. So let's see. I saw a terrific post on one of the Facebook pages the other day from a Dr. Reddy, an interventional cardiologist who preaches plant-based living. I think he's listening but driving, so couldn't join to share. But he had an example of a man he counseled 2 months ago while hospitalized that has now totally changed his life around. And it's really exciting. So like me in emergency medicine, for me, I found it so inspiring and satisfying to be able to answer someone's needs on lifestyle change when they're actually in an event that makes them realize that they need to hear it. And that's why I made this course, so we can all have that. But all right, when their patients are actually ready to hear it, right? Sometimes they're hospitalized. So let's see, Annie, I can see that you're there, but maybe turn on your video so we can see you and hear you.
Can you hear me?
I can hear you, but we can't see you. There's a little video screen that you can, a little video icon that you can click, but we can hear you. You can talk if you want.
Okay.
So you tell us what you do and where you are and how you use lifestyle medicine in hospitalized setting.
So I'm not, you wanted me to do for being a specialist. I'm not
Yes.
hospital, I'm
Okay,
outpatient.
Perfect.
So
Talk to me about it.
I'm actually a physiatrist. I specialize in spine and sports medicine. And we happen to do a lot of EMG testing in our practice. And I ended up being sort of the first person to tell people that they have diabetes or pre-diabetes,
Yeah.
or they had been told that by their primary like a year and a half ago, and they just keep watching the numbers go up. And so that's sort of how I got my interest into learning to counsel people more on lifestyle changes. And I'm sort of like in a transitional phase where I've taken a lot of courses and I really enjoy this type of patient visit, but I also have like a very busy regular practice where I'm seeing, the spine patients under their insurance,
Yeah.
because the procedures we do are very expensive and the testing and stuff. And so what my plan is to, I just set aside like a half day per week to see lifestyle medicine patients and really just pluck out the people that are interested in learning and making a change so that it's progress and enjoyable for me. And I've just had a lot of success so far with patients to the point where I have a waiting list, and I think that when I'm ready I can just opt out of insurances and just do that all on a cash pay basis.
Yeah, awesome. That's
Yeah.
great. I think it's really like important for us all to realize that like even if you don't want to just practice lifestyle medicine, that the information that you can learn from learning it, whether you're certifying or not, is really like totally applicable in like all of our practices. I mean, I remember I was with an interventional radiologist not that long ago sedating a kid for a procedure, and he managed to like sneak in like talk about food and nutrition to the kid and the parent while he was doing the procedure. It was like, you can always do that. It's like everybody can do it. And I think we owe it to ourselves to be able to do it. Yeah. So awesome. Anything else you want to share about being a specialist?
No, just that I think that the lifestyle changes, especially whole food plant-based diet, helps with almost any chronic condition, I see a lot of people with pain, so I don't see that there's really any specialty that wouldn't benefit from incorporating this into their practice.
Perfect. That's great. There might be some questions for you in the chat if you want to answer those. And thanks so much for coming on.
Okay.
All right, so it looks like the person who was going to talk about hospitalized medicine isn't here. So I'm going to move on to kind of shared group visits with Allison Collins. Allison, are you here? Can you give me a chat if you are? It's hard for me to look through all of these people at the time. Let's see here. Allison is here. Perfect. I'm excited to go through the chats when we're done here and see what everybody has been talking about. All right, where are you? Amber, Allison, there you are. Okay. Oops. Okay, you should have that pop up there. All right, so you can bill separate visits, you guys, for shared group visits and medical appointments. It improves access to care, it reduces wait times, it accommodates more patients, it reaches the underserved, it's a more efficient use of time. You can lead group education and then check in privately with each person during the education, but if the education is being done by another staff member, really reduces repetition and utilizes peer support and reduces healthcare costs. And so Allison does group visits, and she's on here to talk to us a little bit about how that looks for her in her practice. And then Allison, if you want your video on so people can see you, you just click that little video icon. There you go. Perfect. Hi, how are you? And maybe you're muted here. It sounds like I can't hear you. That little microphone up there, you might want to click on that. Still can't hear you. Maybe can you check your audio on your computer, maybe? So while she's figuring that out, shared group visits, a lot of people in lifestyle lifestyle medicine are doing this. You can, charge as little as, $5 to $10 for people to come in for them if they're cash pay, but insurance will cover these with people for the same visit. So you can really get a lot more people in and do a lot of different ways. Allison, can you say something again? Oh, bummer, we can't hear you. I'm sorry. Okay. Will you type some things into the chat so people can see kind of how your group visits work? Awesome. So, okay. All right. So, Deepa, hold on a second. Someone is texting me about the webinar. Okay, so, all right, system-wide change. So I'm a little bit bummed that Dr. Jen Schultz couldn't join us tonight. She's here in Idaho with me, and she is killing it. She's at she's the cardiopulmonary rehab director, and she started the CHIP program throughout the whole state system for St. Luke's. That's the Comprehensive Health Improvement Program, which is basically she got the insurance company for the hospital system to pay for employees to take the course whose BMI was greater than 30, and she got it spread across the whole health system. She's also convinced the hospital system to create a department of lifestyle medicine, and she has opened that department within the YMCA gym, where they are having a 6-month intensive lifestyle therapy group that is paid for by some insurances. And they have a health coach, which they're charging as a nurse visit because she's a nurse. They have cash pay for emotional wellness and nutritional classes. They have an exercise physiologist on staff and a gym on staff and a clinical psychologist. And so it's really like community integrative health. It's relationship building, and she's collecting and showing data, and she speaks nationally. She had actually a speech she had to give tonight, and so couldn't make it. But so it's doable at the system level too, if you have the right system, right? My hospital system, not interested, but her hospital system is really going for it. So really exciting. Okay, so we are running a little bit out of time. Let me talk a little bit about billing and coding. Anybody else want to talk about this at all? I'm not sure. Let's see. I have this Lifestyle Pro document that the ACLM sent me. Maybe I'll just send it to you guys as an email because I don't think I can. I thought I could drop things into the chat like boxes, but it doesn't do it. All right. So Regina, are you ready to come on and talk a couple minutes about your app, Invest on Health? And let me find you. And Lori, still no audio? No? Okay. All right. I'm going to take her off then. Okay. And I'm going to find Regina. There you are. Okay. So Regina runs a tech company. She has an app for lifestyle medicine assessment. She'll hop on here, hopefully, and talk to us about it. Let's see here. Someone asked a question about integrating other products Regina, you can turn your video on. I utilize Wildtree, which is a share economy company on organic products. They have a plant-based focus, which is really awesome. And Everskin, which is another share economy focused on clean botanical skincare that I utilize as well. I know others have plant-based supplements and other products. And if you want to, you can drop those in the chat if you want. And if anyone wants to hear anything more about my stuff, just let me know. But Regina, welcome.
Hi, Heather. Thank you for the opportunity, first of all.
Yeah.
I practice out of Bangalore. I run a health tech called IOH, Invest on Health. We have an app which kind of help doctors or lifestyle physicians to monitor their clients' lifestyle progress with respect to their eating habits, their exercise habit, and other aspects of lifestyle. So currently it is working in India. We already started collaborating with the doctors here. We also are in talk with some of the doctors in US, which Karmi Patel and I think Angela Reddy and all knows about it. So just wanted actually, I'll just give you the details on the chat. I don't think we have enough time for going through the presentation and all. I'll just send the link of the website and the app on this chat so that people can try it. And also, like, I would like to connect with you guys to know what else you require. Actually, it's mainly, we ask people to kind of put an image of their basically what they're eating, and we have a group of nutritionists or the nutrient guide sitting in the back end and commenting on the meal. There is a part of it which is automated, and this the nutrient analysis and the exercise, this comes as a report to the doctor, so that the doctor can see that when to take call, when to press the call to action button. If that's what we are doing. So I also want to know a little more about your requirements so that we can incorporate. Especially Heather already has something which is about coaching. So this measure monitoring thing is something which we have. So we can also get into a collaborative mode and work together to help people.
Yeah, awesome. That's really great. And so definitely put the link in there so that people can do it. When I signed up for it, I signed up for it like as a patient sort of by accident. There's a way to sign up as a doctor so you can see how we could use it. If you could give us that information, that would be great.
Sure. I know, actually, because right now we are not giving a doctor sign up directly. Once you are, once you register through the app, we are giving a back-end access, actually. The tech guys has to do it. I think we have got almost 25 or 26 doctors from US. So we will be giving access this week or next week. I have already sent an email regarding this, but we'll be continuously sending emails with the progress of the back-end system.
Yeah, perfect. Great. And then there's some questions here. It says, is it HIPAA compliant for use in the US? And is this app is to monitor patients' info that they input, correct?
Yeah, okay. Currently, actually, the only the lifestyle aspect, which is kind of which we can use it in the US, especially with respect to their lifestyle habits. Actually, we do not have HIPAA complaints and other things in place to use it for the clinical aspect of it as of now. But we're working on it, working towards it. But the other lifestyle elements, like the monitoring of their dietary habits and all, we have already done with a proper system where even the cloud itself is, I think they have taken a service provider in the US or Singapore. So they have those compliance is aligned with the US.
Yeah. Okay, cool. Great. Awesome. So that's Invest on Health, and you can drop that in there in the chat. And it was lovely to see you.
Thank you, Heather.
Thanks.
Okay. Thanks.
Okay, let's see here. So, okay. Lastly, let's see. Anybody else have anything that they wanted to talk about? Especially on the mindfulness stuff. I know Nadia Sabri was, she wanted me to mention that the Berkeley has a great resources on their, I think it's called Be Well or something like that, site. And I've gotten a ton of information from there. All right, let's see here. Maybe we'll do, Deepa is here. Okay, hold on a second. Let me find you. And she's going to talk a little bit about, Deepa, you're on your phone, so I can't let you on. It only happens when you're on your computer. Okay, so we covered a ton of stuff today, guys. We covered what is lifestyle medicine. We talked about how to certify. We talked about kind of examples of what I'm doing, which is different than people who have their own DPC clinics and are doing teaching kitchens. There's people doing group setting, group shared visits. There's people who are integrating this into hospital-based practice. And really, I know I'm kind of preaching to the choir because you guys are on here, but I really, really think that this is just an essential thing for us to all know. I mean, we owe it to ourselves as doctors. We owe it to ourselves as patients. We owe it to our health system to try to take it back, right? And we're going to take it back with, with food and exercise and sleep and mindfulness and decreasing risky behaviors. And so, I'm really pleased that you guys joined me today. And before you go, I definitely want you guys to join my lifestyle medicine course. Again, it starts February 4th. You'll have a community of docs for support and continued learning on Slack, and for group support, and you'll get everything else texted to you conveniently every morning for the podcasts and the assessments. and action plans that you'll need to start implementing right away. It's discounted right now for the first launch, and I think I'm going to probably do 3 a year. And it's basically written because you all asked for it, so I did it for you. So I will put the offer in here again, and I will send an email out with a bunch of information like that coding stuff. I'm just really pleased that everybody's here. And let's see, how do we access the replay? I will send that in a link in the email, but if you probably, yeah, I'll send a link to it. Kranti, you're welcome. Thank you for this. And Heather, thanks for your support. Yashoda, thank you. It's really exciting. Again, my email is heather@wholisthealth.com. And I would really like to talk to anybody who wants to hear more about the course or about our weight wellness program, our fitness coaching, culinary strategy calls, or telehealth practice. And all right, what's an example of a 2-minute takeaway? Amber, the course is $4.99 for 8 weeks of daily information, work, and all those assessments and action plans. Manisha, what is an example of a 2-minute takeaway? Let me pull up one of my weeks here. Lifestyle medicine, where's the course? Let's do maybe coaching, let's see, mindset, let's see, create your own, that one. Okay. Okay, let's see, food. This is stress, depression, food, and sleep. So 2-minute hammer takeaway. This is kind of a quote that I would use to work with your patient and say, I'm often struck by how many of us suffer from anxiety and depression. Did you know that almost 30 of us do, but no one talks about it, so none of us know. And instead of feeling a real, true, vulnerable community, we feel alone. As a medical doctor, I wish we could all talk about it the same way we talk about diabetes and hypertension, and it is the same. In fact, chronic diseases like those can be caused by depression and anxiety and vice versa. And did you know that it's been shown that sleep and food and exercise choices can improve depression and anxiety and prevent and reverse chronic disease like diabetes, hypertension, heart disease, and cancer? Would you be interested in seeing some information on screening for depression and anxiety and what we could do about it? And then you would give them the depression and anxiety screening that I have, as well as the coach document that helps you figure that out, and then the action plan for food and exercise and cognitive behavioral therapy change. So let's see. All right. Anything about, all right, so I think that that's about it. I will send out some information probably tomorrow. I have a dinner date because it's only 7:30 here in Idaho. And so I'm going to run, and I will be back in touch with you guys tomorrow. Okay, thanks everybody.